such a pleasure. We're very thankful that you're here today to talk about outreach to and empowerment of women veterans. Candidly, this is a topic very professionally and personally important to me. And it's important because there's a period of time between me leaving the active duty Marine Corps and becoming a public health professional where, let's just say the period was characterized by a little bit of struggle. And quite frankly, that wasn't a struggle that I saw coming. And it was participation and volunteering with a really outstanding veteran service organization that helped me find my new normal. And today I am so honored to be here with leaders who have special skills and expertise helping veterans transition, yes, but they have special capabilities in terms of outreach to women veterans. So we're going to have an opportunity to learn from all of them. I've asked each to introduce herself to you, and we'll make sure to offer time to answer a couple of questions. If you'll put those in on the app, we'd appreciate it. So ladies, if you would introduce yourselves, we'll get going.
Good morning. My name is Kayla Williams. I served active duty Army for 5 years and then went on to use my GI Bill to go to graduate school. I spent about 8.5 years at the RAND Corporation doing research and analysis on a variety of topics, including veterans, mental wellness, and benefits and other needs. While in my copious free time, because as women we do all of the things, doing a lot of advocacy because I was aware of how my own reintegration had been complicated by feelings of invisibility as a veteran and by the need to be a caregiver to my combat wounded spouse at the same time as dealing with my own issues. I then spent about 2 years working at the Department of Veterans Affairs as director of the Center for Women Veterans. I'm very excited to have a new role serving as the director of the Military Veterans and Society program at the Center for a New American Security.
Good morning, my name is Bruggeman. I am a Marine Corps veteran. I served for 8 years as a Marine. Left the Marine Corps in 2007 and went on first into a for-profit company for a few years. Spent some time as a Marine wife and a mother of 3, raising kids and having some stability in the household as a stay-at-home mom. Started my own business, and then 3.5 years ago came to Mission Continues, first as the executive director for the Southeast region, and now as the vice president of program strategy, and also leading the team that runs our Women Veteran Leadership Summit and all of our women's initiatives at Mission Continues.
Good morning, I'm Kelley. I am currently the Director of Health and Wellbeing at the Bush Institute's Military Service Initiative. I joined the Bush Institute about a year ago after serving in the Department of Veterans Affairs for 15 years. My last role there was as the National Director for Public-Private Partnerships for Suicide Prevention. I'm delighted to be at the Bush Institute these days, continuing to advocate for military families. Our role in the Military Service Initiative is, our mission is to foster successful transition for military families in the post 9/11 generation, and primarily we have a focus on economic opportunity and health and well-being. I spend most of my time over the past year and will into the future operationalizing the Bush Institute's Warrior Wellness Alliance, which I'll be happy to tell you a little bit more about later.
Hi, my name is Antonieta, Rico. I'm currently the Director of Communication and Policy at the Service Women's Action Network. We are the leading national organization advocating for servicewomen and women veterans, both for their collective and individual needs. I'm also an Army veteran. I served from 2001 to 2008. I served at Fort Drum, if anybody out here is from the 10 Mountain. I deployed to Iraq, and I was in public affairs. After I got out, I went back to school. I got my bachelor's in my GI Bill, and I worked both at Army times and Navy times. I've also worked with Women in International Security doing research on the integration of women into combat arms, which all kind of naturally led to me working at SWAN and advocating for service women.
Great. Hi, I'm Megan King. I am the head of new title, Chief Advancement Officer at Team Red, White, and Blue. I was 5 years active duty in the Navy after graduating from Notre Dame and the ROTC unit there. I also played lacrosse at Notre Dame, so Team Red, White, and Blue has been a really nice collaboration of my passions of helping serve veterans, military, and then bringing sports and social activity in order to help veterans with transition. After my time in the Navy, I went to business school
here last year on day 2 of my job. So I'm excited to be up here on this panel and talk about my experience, but also the great work that Team Red Line is doing.
I am so excited to learn from all of you today, and I'm very grateful to everyone in the audience for engaging in this dialogue. So we'll start with a question I often get asked when I say a lot of my research is on service women's reintegration, and that question is, why focus on women? Why focus on women veterans as a distinct population?
So I think it's really exciting that we're up here on the main stage to talk to folks about this topic because women are the fastest growing subpopulation of veterans at this point. We've served in the military since the very beginning, but our numbers were very limited for quite some time. But more recently, our population really started to grow. So today, there are about roughly 2 million women veterans. We're roughly 10% of the population. We skew younger than our male veteran counterparts, so a median age of 50 compared to 65 for men. We also are more ethnically diverse than our male counterparts. When I talk to people about women vets, I tend to stress that we have very few unique needs, and those tend to be related very specifically to childbearing. There are a number of disproportionate challenges that affect us, though. So, for example, even men experience breast cancer. Women just experience it at higher rates. We're also more likely to have experienced sexual harassment or assault during our military service. We're more likely to be the primary caregivers of small children or to have other caregiving responsibilities than men. So, we do have some disproportionate challenges. We also have some ways that we are disproportionately thriving. So we're more likely to use our GI Bill. When we do so, we're more likely to graduate. So we have higher education levels than our male veteran counterparts. We out-earn civilian women by a significant amount. So there are some real strengths that we bring to the table as well.
Yeah, and I want to kind of attack a little bit of the business case for talking about women veterans, and I think you can do that best by breaking down this intersectionality of women and veterans. So there are a lot of people here today and tomorrow who are going to focus on the business case for veterans. Why are we investing in veterans? But it's also important to talk about why do we invest in women at all. So part of that, break that down, and again, thinking about a business case, understanding that everybody in here has a bottom line in some way, whether it's social impact you're advancing, or environmental impact, or financial impact, or the wonderful triad combination of the 3 and a triple impact bottom line, you have a bottom line. That bottom line is benefited by having a diverse team, specifically with respect to gender diversity. So teams that have diversity amongst them with respect to gender are more collaborative, and this is research that has shown this year after year. More collaborative, more creative, more innovative, and when you have a more collaborative, creative, and innovative team, that team is also more engaged. And for any of you who are measuring bottom line, you will know that the engagement of your team has an enormous effect on that bottom line. So again, to put it in business perspective, businesses that had more than 3 women in the top leadership roles in their organization reported 45% higher earnings in 2017. That is statistically significant, I would say. So translate that business case again to any of those 3 bottom lines, and you have your answer there on why it matters to have women as part of your team. And now the challenge, though, that's the good news, why it's important to invest in women. The bad news here is that women are not making it to those levels of leadership on their own. They need a different investment from all of us and a different set of skills, an additional set of skills in order to make it to those leadership positions. They have the experience that they need. They have so many of the tools that they need and absolutely motivation. They're graduating at higher rates. Their educational attainment is higher. However, for some reason, that pipeline is declining drastically as we see them heading into leadership positions. So without that additional investment, you have women entering a corporate pipeline at 57%, and only 18% of CEOs in this country are women. And the number for women of color is 3%. So it's dramatic. We have to invest in a different way in order to take that potential energy that we have in women, and particularly in women veterans, and translate that into an opportunity for these women to serve in leadership roles.
So when Kate first told me she was going to ask this question, I was like, women are awesome. That's why we're talking about women today. And I also had to remind the panel that I'm not a veteran, and I wanted to make sure that they knew that because I was amongst some amazing women veterans today. But in thinking about the challenge that we have specific to wellness and well-being of women veterans. I was delighted to hear this morning so much emphasis from our leaders within the Department of Veterans Affairs as well as in our Community Connections panel about the focus on customers. I think we have, as an ecosystem, really missed the boat on thinking about how we better use data to know our customers. With all of the data that Kayla and Mary Beth presented, I think it's really our due diligence to better understand how do we better market, better target, better develop strategies and programs to meet the range of customers that are our audience base. And I don't mean just from a demographic perspective or from a geographic perspective. I'm specifically interested in the Bush Institute, specifically interested in thinking about how we better understand motivation to seek care and intentionality, and where folks are along the continuum of asking for help. Where are they going to seek healthcare related information? How do we meet them where they are in a more strategic and a more tailored way?
So part of the work that SWAN does is specific research into service women. In 2017, we released a report on how they felt about military service organizations, veteran service organizations. I was part of it. And Kate, feel free to jump in because I know you were a critical part of this research. But what's important for MSOs and VSOs is to realize that how distinct the women veteran population is. So what the survey found was that 71% of women veterans were not part of traditional VSOs and MSOs. And what they said was that they did not feel welcome at this traditional institution. They felt excluded. 30% of them said they did not feel welcome, to be specific on the numbers. So what they are saying is that their specific interests are not being represented at these VSOs or MSOs, and I think anybody who is part of these organizations need to understand how women uniquely feel about them, so that they can do specific outreach to them.
Well, and that leads us, Megan, I'll ask you our next question. This is something the audience has been texting us on the app. There's a gap in traditional veteran service organizations in terms of reaching women veterans. That's undeniable, the data indicate that. So what are some examples of success for a veteran service organization rather than this audience today? How does a VSO reach women veterans?
Sure. So Team RWB actually over-indexes. We're about 31% women veterans in our member population, which is great. I think one of the things that lends to that is the fact that we are very much at the top of the funnel. So we are looking to engage with low barrier to entry. We are also inclusive, consistent, and local. So we are able to meet the veteran, specifically the woman veteran, where they are. We've got 200 chapters across the nation. But then, sort of secondary to that, and maybe even primary, is that we are a volunteer-led organization. And within that volunteer leadership, we are still over-indexing at 28% of our volunteer leaders are women veterans. So, and also, we welcome both veterans and civilians, and our leaders are actually 50% women. So, while they might not see exactly themselves, they were feeling a little bit more comfortable when they come out and see another woman veteran helping in the leadership role. But I really think it is our model of they can find us where they're at, they can come check us out on a monthly basis, weekly, wherever their schedule might match up, but then also within that inclusive nature, if they see something that they'd like to do, they can help have a voice in what's going on at the local level in the chapter. And so we continue to see that population grow. We're going to talk a little bit more about their needs, I think, in a future question. But like Kacie said, we are also focused on some targeting activities. We partnered with Kayla and the VA earlier this year, specifically championing women athletes, women veteran athletes, as a way of showcasing our efforts and our championing of women. So I think that the inclusive nature of Team RWB is really helping get women out and involved, and their ability to come where meet them where they are, but then also some very intentional marketing and targeting to continue that inclusive nature.
How does Mission Continues compare?
Yeah, I mean, I think the way we are able to draw more women into our network, and about 45% of our network now consists of women, which is incredible. The way we do that is by investing in women. So we're showing them that we have a dedicated and long-term commitment to them and to their success, both through our Women Veteran Leadership Summit and our programming that exists around that. So they see that, and every year as that continues to grow and we invest more in that, they see our leadership and they see that we have women in leadership positions as the mission continues. So they're able to see that success model in our organization, and again, just watching that summit grow and that programming around the summit grow every year, and we're able to talk about that and show them the success of partnering veteran women with non-veteran women and helping them expand their network beyond just that one piece of their identity as a veteran. Has been, that's how we've seen that number continue to increase steadily and significantly every year.
So let's say someone in our audience in a veteran service organization succeeds in attracting women veterans to their next event. How do they serve women veterans? What does a woman veteran need?
So I think that the needs of women veterans, like those of all veterans, really vary. So when you're thinking about how your organization can best meet the needs of women veterans, I think it is really important to focus in on where you are on the spectrum and exactly what you want to do. I think of it as being kind of three general, really big buckets. We have women veterans who have intense needs, who may be experiencing homelessness, who are experiencing suicidality, who have poorly treated mental health conditions, serious financial problems, unemployment. They may need very intensive case management. They may need housing. They may need immediate services. Then there's kind of a vast middle of folks who are doing fine. They served in the military. Now they have another job. They don't necessarily need VA health care because they have civilian insurance. They're raising their families. They're going to work. These folks need to know what resources are available if their circumstances change, or if they encounter somebody who is struggling. But they may not need anything. And then we have folks who want to, I think of it as leveling up, right? I had a bachelor's degree. I wanted to use my GI Bill benefits to get to the next level. I think of organizations like The Mission Continues and Team RWB as being kind of part of that. These are organizations that can help people jump to the next level of functioning and really improve how they're doing. But you're not providing, emergency financial grants to help people make it to the next month's, paycheck. So when you're thinking about what needs you want to meet, really consider what population you're trying to target and then how women may fit within that. So women who are looking to find employment may need help with childcare. Like, that's a huge barrier. When we had 2 kids under 2 in our family and we had them both in full-time daycare, it cost $36,000 to have 2 kids in full-time daycare. Like, that's a salary in a lot of places. So this is a key need that women may need met if they're looking to have their employment needs met. If you're trying to think about how to enable women to be more involved in athletics, Team RWB, a great example where I am, they have a Saturday morning run at a park that has a great playground. So I can bring my kids, they're playing while I'm running, so that meets my need as something that helps me get more engaged with my community.
Yeah, so I'll add to that. And I appreciate the call out. I think it's something we absolutely focus on and note as a need around childcare for women and men. Had a conversation this morning about that. So we've been really lucky that, excuse me, to work with Kate on a very specific research project with our research team as an evidence-based organization, really focused on what we call our enrichment life scale. So, our enrichment model and being able to analyze that. So Kate was able to help us with some data analysis and helped us notice that women are actually coming into Team RWB and on sort of all factors very similar to men in terms of enrichment, with the exception of 2 factors. They are reporting less connected to social support, so they're feeling like they are lacking that, and they are also feeling like they are lacking a sense of purpose. So as we look at our audience, we're able to say and understand that women are specifically coming in with those 2 lacking factors when it comes to their total enrichment or fulfillment. And so what we are focused on is then being able to take that analysis of our new CRM system that we just implemented, and being able to really do comparisons between the academic research of our outcomes-based model alongside what are veterans, what are these specific individuals doing at the local level, where are they seeing greater uptick in behavior changes, what's getting them out. Specifically the social support and sense of purpose, we continue to bring that up with our volunteer leaders and focus on how we are that bridge between the individual veteran and then the community. Again, we bring together both veterans and community members, and so we really see ourselves as a great bridge to help understand your sense of social support amongst your peers, but then also in your local community. So you're building that network that helps you then continue to build that sense of purpose and how you're giving back. You're making yourself better for the next day, but also having a better connection to the community, be able to do so. So for us, it really is the evidence-based outcome model, but then analyzing the real data, what's going on at the local level, and being able to make some changes and do some targeting and make sure the program is really meeting those needs that we're seeing through the enrichment model.
Well, and what about working together? Kacie and Tony, you both have some really interesting alliance and coalition initiatives. What can you tell us about reaching women veterans collaboratively?
So one of the things that I'm most excited about for the Alliance is the sort of collective power that we have. So the Bush Institute's Warrior Wellness Alliance is currently made up of 13 organizations that span the care continuum, from organizations such as Team Red, White, and Blue, The Mission Continues, Women Warrior Project, Student Veterans of America, Team Bruggeman, up towards more traditional clinical care programs and outpatient mental health care, the Women Veteran Network, the 4 Women Warrior Project Warrior Care Network sites, and so forth. And because we have sort of the continuum of care at the table, we are able to look at how we do a better job of understanding our customers. The peer networks that are sitting at the table with us make up an aggregate of approximately 1 million post-9/11 veterans. And when we start to think about how we segment that customer base from a needs, from a geography, from a demographic, from a motivation to seek care, and then we can take advantage of the great data that the organizations are collecting independently about what is working and what are the key ingredients, we're much better positioned to optimize for the needs to meet a range of audiences. And for us, we believe that if the Bush Institute believes that we can solve for veterans' mental health needs and women veterans' mental health needs, that veterans are actually going to lead the transformation that needs to happen in our country related to mental health care and how we think about that and how we operate around that.
Yeah. So I think what women veterans have told us in the research that they need is that they need to have their voice listened to. In the report that I talked about, we found that they actually said that they needed a collective voice to advocate for the specific hard challenges that women veterans face. And I think it's important to recognize that there are specific challenges unique only to women veterans, and they are very prominent. And which leads me to mention, we listened to what women veterans were telling us, and actually SWAN tomorrow is convening the Military Women's Coalition. So I've heard a couple of times here during the symposium, people say that there's over 40,000 veteran service organizations. Only a handful of them, less than about a few hundred, are actually women veterans specifically focused. And tomorrow we're convening almost close to 50 groups from across the country that specifically serve women veterans and service women to unite and form a coalition that will advocate for cultural change within the military and within the Department of Veteran Affairs, and push forth policy changes that will focus on the specific well-being of service women and women veterans. So if you're interested in seeing the live stream of the coalition, just visit us on our Facebook page, Service Women, and we'll be live streaming that.
Fantastic. And because I just joined the Mission Continues team, I'm privy to some exciting work that they're doing with Lean and military women. Mary Beth, would you be willing to share that with everyone?
Yeah, so Lean In military network is vast. So almost 5,000 members, active members in between Lean In DoD and Lean In Women Veterans. And one of the things that I think Kate and I are really excited about is we were asked just a couple of months ago to be a part of not only combining the two into a larger umbrella, but also doing a lot more to connect Lean In DoD, which for those of you who aren't familiar with Lean In, this was an initiative that was started by Sheryl Sandberg, CEO of Facebook, several years ago, following the success of her book, Lean In, which again just talks about women leaning into life, work, home, whatever it is, just leaning in more. But these circles have been established as interest groups across the country, serving some in small towns and cities and communities, and some, women engineers, Lean In engineers. There's just all these different interest groups that have popped up. So Lean In Military Women has one that consists of Lean In DoD and Lean In Women Veterans, and finding more ways to connect the two. So we have a little bit more of a continuum, and we're reaching back into the DoD to ensure that women who are still serving on active duty understand that they have a lot of support on the side of women veterans, and women veterans are able to, we're able to influence across those lines a little bit more than we ever have been. So that's an exciting initiative.
Wonderful. So the next question is one we planned on talking about, but it's also come through on the app. What happens when you've got a veteran service organization, and I'll share a little story. I had a friend who was working for a civic organization, and she said, I've got it. We've got women veterans coming to our events. Nobody is asking them if they're there to pick up their husband. So we're going to plan something really big. We're ready. I'm going to do a spa day with women veterans and dependent spouses. It's going to be amazing. And I kind of went, oh no. And no women veterans showed up, and she asked me afterward what happened. So the question is, when a veteran service organization is trying to serve women veterans, well-intentioned, what are some pitfalls to avoid? What should they not be doing?
I think there are several things that I would recommend against. So first, take a really careful look at your materials and ensure that they are visually representative of this population. So if you only have pictures of white men, you're doing it wrong. Because that's not what our population looks like anymore. You need to show diversity. Keep in mind, again, that women are more ethnically diverse than men. So I love this panel, but make sure it doesn't look too much like this panel. We're a little too white. So really go for, make sure that your imagery is visually representative of the population that you're serving. Make sure that your leadership, if as much as possible, is representative, as Mary Beth talked about, but also that whoever your leaders are, that they're using gender-inclusive language. If they are only talking about men who have served and the women they leave behind while they go off to war, have them wake up a little. And you can't control what your members say and do, but I think that if you're paying careful attention to your imagery and your language, that hopefully that will start to trickle in. I've personally been at VSO conventions. I have friends who have been at VSO conventions where we're wearing the credentials like all of you are wearing, and some nice older gentleman will come up and be like, did you know this is a convention for veterans? And I'm like, in fact, I do. I am? Okay. That gets really exhausting when you have to do that over and over and over, and women will not show up if they feel excluded in that way. I also would recommend against, so REI, Sporting Goods Store, they've done a really great job recently trying to improve their outreach to women, and they said, you can't just shrink it and pink it. You can't just take the stuff you make for men, make it smaller, and turn it pink and expect it to work. Don't have males, don't have all male panels. There is a whole Tumblr feed that makes fun of these, where you do not want to end up on a panel of shame. I have seen panels about women veterans without women veterans on them. Don't do that. So those are, I think, a few of the really significant pitfalls that I've seen, but I'm sure y'all have seen others.
Yeah, the funny ones.
Well, and I'll mention two quick things. One is that in some of the qualitative studies we did back in 2014, which kicked off our initiatives around women veterans and helped to inform them, one of the things we learned, and touches on something Megan brought up, is that only 30% of the women that we surveyed reported feeling struggles that they have shared with childcare, with disproportionate number of domestic household duties falling on them, with challenges of supporting a spouse, and so many other things, discrimination, harassment in the workplace, all of this. Women veterans do not have the market cornered on any of these topics. So connecting them out to a broader connection of non-veteran women, but more broadly, for the VSOs out there, connecting to communities. So these women are coming to us because they want to serve. They're coming to your organizations because they want to serve. They are veterans at the heart. So ensuring that some connection to community and some impact on community is at the center of what you do is important. And the other very quick thing I'll touch on is that we use the word diversity a lot. Diversity is a number, and it means nothing if you can't encourage authenticity. So if you've got people sitting in the room who look different, but you're not encouraging and enabling them to actually use their authentic voices, it's not meaningful at all. And in fact, they will feel exactly like these women felt and I felt in the military and in the Marine Corps, where I'm really glad I was the token woman sitting at a table with 35 men so many times, but the fact that my voice wasn't encouraged or heard, I was just another man at that table of 36 of us. So that was really important. So for all the organizations out there, find ways to be really inclusive of women and encourage authenticity of women in your programming, and then find ways to connect to community and have an impact.
Just really quick, I wanted to give a specific example to give context to what we're talking about diversity. I was enlisted for the Army, and SWAT is compiling demographic data that we're going to release next year on the makeup of the military. So we're looking at the numbers right now. Specifically, in the Army enlisted service women, 66% are minorities. So that's about 40% African American and about 18% of Hispanic or Mexican origin, like myself. If you look at that, at the male enlisted population in the Army is the reverse. About 70% is white male. So this is a specific example of how diverse the enlisted Army demographic is and overall in DoD. So I think it's really important not to lump service women with all of the veterans together. And then also just to go back to what you said, when service women come to VSOs, they're not looking for opportunities to socialize. What we found in our report was that they're looking for opportunities to advocate or build coalitions around the specific needs of service women.
And I'll just add real quick, I think we've sort of all hit on it, but I think we see it daily for women and men, is trying to meet the veteran or the civilian who's joined us where they are at in their life cycle. So, people who joined Team RWB 5 years ago maybe didn't have children or were just recently out, and so they could come on a very, weekly, maybe 4 times a week they would come out to our activities. And so we have to be really intentional in understanding, are we providing the offerings, like Kayla says, there are a playground in your local community that you could host a run around? Is there childcare options that we could weave in some way to ensure families can actually come and participate? So really understanding the life cycle of the member and what they're going through, and not being very focused potentially on what you think they are, but really understanding, using the data to understand that life cycles change, and we want to try to meet them and make it as easy as possible for them to plug into us to then be able to help. And then the backside of that is we're really focused on the relationship building that comes through Team RWB, and it is about that networking. That's personal and professional. And so being able to come out and know you have a friend who is going to meet you there on Wednesday, and being able to have someone that you can follow up with. That one friend is going to help you come to that next event or be involved in the following month. So we're seeing that is really critical across all of our audiences, but very specifically for women, especially as they are reporting the support challenges. So again, I think it's understanding where they're at, and then following up and helping to foster that trusted relationship.
I'd just like to summarize, because I think there was a lot of really great points that were made. And when people ask me, or they tell me they want to do something, whether it's related to women veterans or veterans at all, I always ask the question, we've identified a problem that needs solving that someone else is already working on. And I think taking that moment to pause and looking around at the information that we thankfully now have available after the past 15 years of work, to gather some data about what other organizations are already doing that you might be able to support, or where I'm getting increasingly concerned is how do we do a better job of finding women veterans who are not connected to any of these organizations. And I would just encourage you to think about what might be a need and a gap that's not being filled in your community as you go forward with your new great idea.
Well, and that was a question that came through on the app. So there's this issue with women veterans being reticent about self-identifying as women veterans. How, as community leaders, can we assist with that issue?
I'll chime in quickly. Well, I think some of it is awareness. I mean, one of the reasons that women don't self-identify is because they have a different view of their own service based on how we as a society have presented veterans. We've presented veterans, especially in the last 17 years, as lots of deployments, lots of combat action. I mean, you see, most of you have likely talked to somebody who has a certain visual of what a veteran looks like, and I'm not it. So, helping to bridge that gap a little bit so that women veterans just feel a little bit more comfortable talking about their service and can understand and have the recognition around the fact that their service is just as worthy as the service of their male comrades. Because just to Kayla's point, proving over and over and over again your worth in the military was exhausting enough, but having to come out as a veteran and prove over and over and over that you are also a veteran and hold that title. And when I run with my USMC t-shirt, my husband is a Marine. I'm proud of that. That's not why I'm wearing the t-shirt. I'm proud of my service as well.
And I just want to add, just on top of that we also have to be aware of, or at least give some training to the people in your organization of how they respond to women veterans. How do they help them feel excluded or like they don't belong? Because like she said, if we talk about our service, there's people who actively challenge and question our service within veteran service organizations. I see it most often within our own fellow veterans who challenge our service, and at some point you just kind of get tired, like you said, of having to prove yourself, so you just back away and you don't participate. So of your own members, there has to be some sort of training that helps them become self-aware of how they're excluding women from your organizations.
I can also add, we've heard examples of some of the newer organizations that are actually really succeeding very well. And I think that the younger generation of women vets is more likely to self-identify than prior eras, especially those of us that have been to combat. Like, we know we're vets. The generation I'm concerned about are older women veterans. And so when you're thinking about, the population that may have higher needs, that's where I lose sleep, right? And when we're trying to think about fighting homelessness, getting a geriatric homeless woman veteran employed may not be a viable long-term option, right? Like, we need to really be thinking about the needs of geriatric women veterans, how to find them, how to get them to identify, how to meet their needs. And I'll throw out as a charge to those of you who are reaching into your broader communities and trying to pull together coalitions, as we heard about on the last panel, which is fantastic. Reach out to those who are serving older populations, make sure they're thinking about women as vets. And bear in mind that one of the biggest unmet needs is legal needs. So we are trying to pull together resources. Pro bono attorneys should be on the list of things that you're thinking about trying to provide.
Sorry, I don't want the panel to end. We've been focused a lot on needs. Needs of the word.
We're going nowhere.
Good. I like the rule breaking mentality up here. We've been focused primarily on needs of women veterans, and I don't want to lose sight of the fact that we also have more women running for political leadership positions. Women are also ascending to more leadership roles with support and the organizations that are represented up here, as well as others. And one of the lessons I think that can be learned from the work over the past 15 years is that we need to be really mindful to walk that line between supporting our women veteran needs, but also making sure that we recognize them as assets and leaders in our communities around the country. I really want
I mean, we've heard from two great organizations that are on this stage. We also know that among Student Veterans of America, 50% of their chapter leaders are women. We know that women vets are disproportionately represented in Team Rubicon as volunteers. So, kind of across the board, we know that in the civilian sector, women volunteer at higher rates. We know that veterans volunteer at higher rates than civilians. So we see that women veterans volunteer at very high rates. They're extremely engaged in their communities. They are leaders. Yes, we have a minority that has intense needs. Let's meet those needs. But the vast whole, we're coming back to our communities and finding new ways to serve and empowering us and getting us to be able to do that in the company of other veterans helps with that social support that is so important and will enable us to really continue thriving at a new level and be able to turn around and pay it forward to the next generation.
So we've got some incredible questions from the app, and if everyone's open to that, we'll address a few of these. A major focus of the next couple days is service organizations playing nicely in the sandbox together. And so the question I have for you is, organizations serving women veterans, what have you seen work really well? What have you seen not work so well in terms of community collaboration?
So for us here in Team RWB, here in Atlanta, I think we actually have a really great collaboration model that it continues to evolve with a number of partners, and was actually just speaking with someone earlier that, as various members of the military, you sort of come in with a loyalty based on your veteran status or active duty status, and so it's sort of ingrained in you. I know we joke about it a lot. I think I was at our first Navy hire, that you're Navy or you're Army, and you sort of carry that into the VSO environment as well, whether you're Team RWB or the mission continues. But I think we're really doing a good job in major markets of coming together in collaboration to say, we're all wearing this sort of veteran uniform together to better ourselves and our communities. And I think the more that we can continue to champion that and say you don't have to pick one that's best for the other of us, we're going to continue to see veterans leading and veterans making an impact and helping tell the story, really by our actions. And that's going to continue to push us forward in a way that collaboration is going to bring not only those needs to the forefront, but also, like Kacie was mentioning, sort of the flip side, like you meet their needs and then watch them, sort of grow and soar together. So I think collaboration is really continuing to evolve on our behalf.
I want to make sure we get this question in from several of you, and thank you to the nerds in the room that asked it. Let's say that interest has been sparked, people want to go and read the research that all of you mentioned. If a service organization is inspired to start doing outreach to women veterans, wants to check the data, where do they need to be looking? What's the must-read stuff on reaching women veterans?
Well, obviously, I'm going to talk about so much research because most of my research is service women specific. We are the leading national organization that focuses on just them, and we surveyed over 1,300 in each one of our reports, and we bring service women together where they can come up with solutions on their own to the problems that they face or the challenges that they face. And you can find all our reports, which are free and to the public, in our website at servicewomen.org. And the other organization I've seen do women veteran specific research is the VA. So.
Yeah, if you go to the VA website, va.gov/womenvet, and then click on the research link, there is a vast amount of research available there, both VA reports and non-VA reports. There's also a really nice compilation of research published in PubMed related to military and veteran women. So that's something that I would definitely recommend you check out. There's a great barriers to care report that I think is really essential when thinking through what barriers women encounter when trying to get care. And also there's annually a profile of women vets that has some kind of high-level data on how women veterans are doing compared to male veterans and compared to civilian women.
Well, and two more, obviously I'll champion permission, and all you have to do is Google permission. It's right there at the top. And then the second one, CNAS actually has done some great research and work. Phil Carter and Kate Kidder over there did a great body of work around women veterans some years ago. Battlefields Boardrooms is a great publication of theirs. There are others on their website that you can look at as well that I think are really digestible and relevant.
And I just want to comment, these are all really great resources, and I am encouraged by how much more people are talking about data and outcomes. And to just exclamation point that a little bit, I specifically encourage you to look for outcome-based measurement as opposed to output. I think we're beyond the point of talking only about number of veterans served and really start talking about the impact that we're having on veterans' lives.
Yes, absolutely. Well, we are at the end of our time together. I want to warmly thank you for engaging in this conversation and dialogue. We hope that you've left inspired about outreach and empowerment for women veterans with your organizations. Thank you so much to the panelists for everything that you taught us today. Appreciate your time.
Ladies and gentlemen, we hope you enjoyed our session. We're going to now take a 10-minute break so you can go to your breakout sessions.